Good day and welcome. If you're waking up multiple times a night to use the bathroom, you're not alone. This common condition is known as nocturia, and it can significantly disrupt sleep quality, energy levels, and overall well-being. While occasional nighttime urination may be normal, persistent or frequent waking can be frustrating and may even point to underlying imbalances or habits that need to be addressed. The good news is, in many cases, there are practical and effective changes that can help. Today, we'll discuss 8 of the best habits to stop frequent urination at night. To begin with, one of the most important habits is limiting fluid intake in the evening. This might sound obvious, but many people unintentionally drink large amounts of water, tea, or other beverages during the hours leading up to bedtime. Hydration is essential, of course, but it's best to get most of your fluid intake earlier in the day. A helpful rule is to reduce or stop drinking liquids about 2 to 4 hours before you go to sleep. This gives your kidneys enough time to process the fluids, reducing the likelihood that your bladder will need emptying during the night. The second habit is avoiding substances that irritate the bladder. These include caffeine, alcohol, carbonated drinks, citrus juices, spicy foods, and artificial sweeteners. Many people enjoy a cup of coffee, tea, or a soft drink in the evening without realizing that these beverages can stimulate the bladder and increase the urge to urinate. Alcohol, in particular, not only acts as a diuretic, but can also interfere with sleep quality. By minimizing or eliminating these triggers from your evening routine, you may experience fewer disruptions overnight. Next, establishing a consistent sleep and bathroom routine is highly beneficial. Before going to bed, make it a habit to empty your bladder, even if you don't feel a strong urge. Over time, this trains the body to associate urination with bedtime, reducing the need to wake up later. Maintaining a regular sleep schedule also helps regulate many bodily functions, including hormone release and kidney activity. This consistency can contribute to more restful, uninterrupted sleep. Another often overlooked strategy involves leg elevation. For people who experience swelling in the lower extremities, such as the ankles or feet, fluid tends to accumulate in the legs during the day. When you lie down at night, that fluid is reabsorbed into the bloodstream, filtered by the kidneys, and sent to the bladder, leading to nighttime urination. Elevating the legs for 30 to 60 minutes before bed or wearing compression stockings during the day can help redistribute this fluid more evenly and reduce nocturnal trips to the bathroom. Managing underlying medical conditions is also essential. Conditions like type 2 diabetes, congestive heart failure, sleep apnea, and benign prostatic hyperplasia, commonly referred to as an enlarged prostate, can all contribute to nocturia. If you suspect an underlying issue, it's important to work with a qualified healthcare professional to investigate and manage it properly. For instance, treating sleep apnea with appropriate therapies can significantly reduce nighttime urination in some individuals. Likewise, good blood sugar control in diabetes can help normalize urine production and decrease nighttime frequency. Another helpful habit involves physical activity, particularly exercises that strengthen the pelvic floor muscles. Known commonly as Kegel exercises, these routines help enhance bladder control and reduce feelings of urgency. They involve contracting and relaxing the muscles used to stop the flow of urine. Practicing these exercises regularly, ideally daily, can lead to noticeable improvements in urinary frequency and control, especially over time. Additionally, it's worth paying attention to the temperature of your environment. Cold conditions can cause blood vessels to constrict, leading to increased urine production. Keeping your bedroom at a comfortable, moderate temperature may reduce the stimulation of the bladder during sleep. While this isn't a standalone solution, it can be a supportive factor when combined with other healthy habits. Lastly, some individuals find it helpful to monitor their bladder behavior by keeping a diary. This includes tracking fluid intake, urination times, and volume. Over a few days, patterns can emerge and certain triggers may become clear. This kind of self-awareness is invaluable and can inform better decision-making about diet, hydration, and lifestyle. In summary, nighttime urination, while common, doesn't have to be an unchangeable part of life. By implementing a few smart habits, like adjusting your fluid intake, avoiding bladder irritants, sticking to a regular schedule, managing underlying conditions, and practicing pelvic floor exercises, you may be able to dramatically reduce how often you wake up at night to use the bathroom. It's all about understanding your body, observing what works for you, and being consistent with those changes. One of the most effective and simplest strategies to reduce frequent nighttime urination is being mindful of how much fluid you consume in the hours leading up to bedtime. Many people don't realize just how much their evening drinking habits contribute to disrupted sleep. While staying hydrated throughout the day is essential for kidney function, digestion, and overall health, consuming large volumes of liquids too close to bedtime can overload the bladder, making it more likely that you'll need to wake up during the night to urinate. It's not just about water. Teas, juices, soups, smoothies, and even fruits with high water content can all contribute to your body's fluid load in the evening. A helpful practice is to gradually taper your fluid intake, starting about 4 hours before you go to sleep. This gives your body time to process and eliminate excess fluids through normal urination while you're still awake. Doing so significantly reduces the chances of bladder fullness triggering a nighttime awakening. Some individuals find it helpful to schedule their last cup of water or other beverages by early evening and make a conscious effort to limit sipping out of habit afterward. It's important to note that this strategy does not mean you should become dehydrated or drastically cut fluids throughout the entire day. On the contrary, proper hydration during the morning and afternoon allows your body to maintain healthy function without the need for late night compensation. In fact, drinking more water earlier in the day and reducing it later can train your body to adapt to a more favorable pattern. You're less likely to experience intense thirst at night if you're well hydrated earlier on. This balanced approach supports both bladder health and restful sleep. Some people are unaware that they may be drinking excessive amounts of fluid close to bedtime because of certain habits like late night snacking, taking evening medications with a full glass of water, or simply keeping a water bottle nearby and sipping out of boredom or routine. Becoming more conscious of these behaviors and making small adjustments, such as taking medications a bit earlier or setting a cutoff time for drinks, can lead to significant improvements in sleep continuity. Finally, if you feel thirsty at night, it's usually okay to take a small sip of water, but frequent or large intakes should be avoided unless medically necessary. If you're experiencing constant dry mouth or thirst, that could be a sign of another issue that should be discussed with a healthcare professional. Otherwise, for most people, limiting fluid intake in the evening is a safe, practical, and effective habit that plays a key role in minimizing the impact of nocturia. When combined with other supportive changes, this single step can lead to more restful nights and more energized mornings. Another important lifestyle habit that can help reduce frequent urination at night is avoiding common bladder irritants, especially in the hours leading up to bedtime. The foods and beverages we consume can have a significant impact on bladder sensitivity and function. Certain substances can irritate the bladder lining, increase urgency, and lead to more frequent urination, particularly during the night when your goal is uninterrupted rest. By identifying and minimizing these triggers in your evening routine, you may notice a considerable improvement in your ability to sleep through the night. Caffeine is one of the most well-known bladder stimulants. Found in coffee, tea, many soft drinks, energy drinks, and even some chocolate products, caffeine has both a diuretic effect, which increases urine production, and a stimulating effect on the bladder muscles, which can lead to increased urgency. Even if you've built a tolerance to caffeine during the day, consuming it in the late afternoon or evening may still affect your bladder and disrupt sleep. If you enjoy tea or coffee later in the day, consider switching to a non-caffeinated herbal version that is gentle on the bladder. Alcohol is another common culprit. While it may feel relaxing, alcohol is a natural diuretic and can interfere with the body's regulation of urine production. It also affects sleep architecture, meaning that even if you fall asleep quickly, the quality of your sleep may be poorer, and you're more likely to wake up throughout the night, including for bathroom trips. Limiting or avoiding alcohol intake in the evening hours can make a significant difference for individuals struggling with nocturia. Carbonated beverages, such as sodas or sparkling waters, can also be problematic. The bubbles themselves may not seem harmful, but carbonation can cause bladder irritation in some individuals. When combined with caffeine sugar or artificial sweeteners, the impact is often amplified. Similarly, acidic foods and drinks, like citrus fruits, tomatoes, and citrus juices, can also irritate the bladder lining, making it more sensitive and reactive. This can lead to the sensation of needing to urinate more frequently, even when the bladder is not full. Spicy foods, artificial sweeteners, and processed snacks may also contribute to bladder discomfort and increased frequency. Some people are more sensitive to these irritants than others, so it's helpful to pay attention to how your body reacts after eating certain meals or snacks, particularly in the evening. If you notice a pattern of disrupted sleep or increased urgency following certain foods or drinks, reducing or eliminating them during dinner or late night hours may help. Importantly, avoiding bladder irritants does not mean eliminating all flavor or enjoyment from your meals. There are many soothing bladder-friendly alternatives that you can enjoy without the unwanted side effects. Foods that are mild in acidity, low in added sugars, and free from artificial ingredients are typically safer choices. Drinking non-caffeinated herbal teas such as chamomile or peppermint, for example, may even support better sleep and hydration without triggering the bladder. Everyone's tolerance is different, so it can be helpful to keep a simple journal or mental note of what you've eaten and how your body responds. Through a bit of observation and trial and error, you can develop a personalized approach that supports both your bladder health and your sleep quality. In many cases, avoiding bladder irritants in the evening, particularly those that are acidic, carbonated, caffeinated, or alcoholic, can be a small but powerful shift that leads to more restful nights and fewer trips to the bathroom. Creating and maintaining a consistent sleep and bathroom schedule is a simple yet powerful habit that can significantly help in managing nocturia, or frequent nighttime urination. Many people overlook how much of an impact daily routines have on the body's internal clock, also known as the circadian rhythm. This biological clock plays a crucial role in regulating various bodily functions, including the production of urine. When your sleep and bathroom habits are irregular, the body can become confused about when it's time to rest and when it's time to stay active, which may contribute to waking up frequently during the night to urinate. By going to bed and waking up at the same time every day, even on weekends, you help your body establish a predictable rhythm. This consistency helps regulate hormone production, including the release of antidiuretic hormone, ADH, which is responsible for slowing down urine production while you sleep. When your sleep routine is erratic, the body may not release adequate levels of ADH at night, leading to increased urine output and more nighttime awakenings. Over time, sticking to a regular sleep schedule helps reinforce the body's natural rhythms and can lead to deeper, more restorative sleep with fewer interruptions. Just as important as your sleep routine is your pre-bedtime bathroom routine, making it a habit to use the restroom right before you go to sleep, even if you don't feel a strong urge, can train your bladder to empty more completely and reduce the chances of needing to go again during the night. This practice helps condition the body and bladder to associate the bedtime routine with a final opportunity to void, thereby decreasing the likelihood of disruptions. Another effective strategy is to avoid lying down for extended periods during the day, especially if you're trying to manage fluid redistribution. In individuals with swelling in the legs or fluid retention, lying down too early can cause that fluid to move into the bloodstream and increase urine production when you're trying to rest. Instead, incorporate brief leg elevation earlier in the evening and remain upright until your normal bedtime to help manage this issue more effectively. People who suffer from nocturia may also benefit from scheduling bathroom visits throughout the day, about every 2 to 4 hours. This can help prevent the bladder from becoming overly full, which could later contribute to more urgency and increased nighttime trips. A well-regulated voiding schedule during the day supports better bladder control and helps reduce the chance of nighttime overactivity. It's also important to prepare your mind for rest. A consistent pre-sleep routine, such as dimming the lights, turning off electronic screens, engaging in light stretching, reading, or practicing deep breathing, can signal to the body that it's time to wind down. Reducing stress and mental stimulation before bed may also play a role in decreasing nighttime awakenings, including those related to bladder activity. Many people find that poor sleep quality worsens the perception of bladder urgency, even if the physical need to urinate is minor. By sticking to a structured bedtime and bathroom routine, you create conditions that encourage the body and bladder to work in harmony. Over time, this consistency trains your system to reduce nighttime disruptions naturally. It's not about perfection, but about making these practices part of your daily rhythm. In the long run, a reliable routine can lead to improved sleep quality, fewer nighttime awakenings, and better overall bladder health. Elevating the legs before bed is a surprisingly effective yet often overlooked strategy for reducing nighttime trips to the bathroom, particularly for individuals who experience swelling in the lower body during the day. This swelling, also known as peripheral edema, is commonly seen in people who spend long hours standing or sitting, as well as in individuals with certain medical conditions that affect circulation. During the day, gravity causes fluid to accumulate in the legs, ankles, and feet. When you lie down at night, this fluid gets redistributed into the bloodstream and eventually filtered by the kidneys. As a result, your body may produce more urine during the night, leading to frequent awakenings to use the restroom. By addressing this fluid buildup before you go to bed, you can help reduce nighttime urination and enjoy more restful sleep. Raising your legs for 30 to 60 minutes in the evening can help this fluid move back into circulation gradually, giving your kidneys time to process and eliminate it before you go to sleep. This practice is simple and can be done while reading, watching television, or relaxing. Ideally, your legs should be elevated above the level of your heart. You can achieve this by lying down and propping your legs up on a few pillows, a wedge cushion, or even using a reclining chair that lifts the legs. Consistency matters here. Making this a regular part of your evening routine can help your body adapt and respond better over time. In addition to reducing fluid-related nighttime urination, leg elevation can also relieve the sensation of heaviness or discomfort in the legs and ankles, which may itself interfere with sleep quality. For people with mild to moderate circulatory issues, this practice can support better venous return, the process by which blood moves from the lower limbs back toward the heart. Improved circulation not only reduces fluid pooling, but also contributes to overall cardiovascular health. This technique is especially helpful for individuals who have sedentary jobs, limited mobility, or are prone to swelling due to lifestyle or aging. In some cases, wearing compression socks during the day can work in tandem with evening leg elevation to reduce overall fluid retention. The goal is to prevent excessive fluid from suddenly shifting during the night, overwhelming the kidneys, and leading to increased urine production. It's important to note that this is a supportive lifestyle measure and not a replacement for medical advice if you suspect a more serious condition. If swelling in the legs is severe, painful, or accompanied by other symptoms, it's a good idea to consult with a healthcare provider. However, for many people experiencing mild to moderate swelling, simply elevating the legs before bedtime can make a noticeable difference in nighttime bladder activity. The beauty of this habit is in its simplicity. It doesn't require any special equipment or medication, just a few extra minutes each evening and a commitment to taking care of your body. Combined with other healthy nighttime habits like limiting fluids and avoiding bladder irritants, leg elevation can be part of an effective strategy to reduce nocturia and improve sleep quality. Small changes like this, when practiced consistently, often lead to big improvements in overall comfort, restfulness, and daily energy. Managing underlying health conditions is a crucial part of addressing frequent nighttime urination, also known as nocturia. While lifestyle habits play a significant role, it's important to recognize that this symptom can sometimes be a sign of broader medical issues that require proper diagnosis and treatment. Simply reducing fluids or adjusting your evening routine may help, but if the root cause is related to an ongoing condition, these efforts might only provide limited relief. Taking a closer look at your overall health can lead to more effective, long-term improvement in both bladder function and sleep quality. One of the most common medical contributors to nocturia is diabetes. When blood sugar levels are not well controlled, the kidneys work overtime to remove excess glucose from the bloodstream through urine. This can lead to increased urine production even during the night. Individuals with undiagnosed or poorly managed diabetes may find themselves waking up multiple times to urinate without understanding the connection. By working with a healthcare professional to manage blood glucose levels through diet, medication, and exercise, this type of nighttime urination can often be significantly reduced. Another condition that may contribute to nocturia is sleep apnea. This sleep disorder causes intermittent pauses in breathing during the night, which can lead to low oxygen levels and changes in heart function. As a response, the body releases certain hormones that increase urine production. Many people are unaware they have sleep apnea, but if you snore heavily, feel unusually tired during the day, or experience frequent awakenings at night, including to use the restroom, it's worth getting evaluated. Treating sleep apnea with therapies such as CPAP's continuous positive airway pressure can not only improve sleep quality but also reduce the urge to urinate at night. For men, an enlarged prostate, also known as benign prostatic hyperplasia (BPH), is a common cause of nocturia. The prostate surrounds the urethra, and when it becomes enlarged, it can press on the urinary tract and make it harder to fully empty the bladder. This can result in the need to urinate more often, including during the night. Medications and other treatments are available to help manage this condition, and early evaluation can prevent further complications. For women, hormonal changes during menopause and pelvic floor dysfunction can also affect bladder control and nighttime urinary frequency. Addressing these changes through medical support and targeted exercises may be beneficial. Heart and kidney conditions can also contribute to nocturia. In cases where the heart is not pumping efficiently, fluid can accumulate in the legs and be redistributed at night when lying down, leading to increased urine production. Similarly, if kidney function is compromised, urine output may become irregular. Managing these conditions under the guidance of a healthcare provider can improve fluid balance and support better nighttime comfort. It's also worth noting that certain medications, such as diuretics used to treat high blood pressure or fluid retention, can increase urine production. If these are taken later in the day, they may contribute to nighttime urination. In some cases, adjusting the timing of medications under medical supervision can help reduce this side effect. The key takeaway is that nocturia is often more than just a simple inconvenience. It can be a sign that something deeper is going on in the body. By taking a proactive approach to managing chronic health conditions, you not only improve your overall well-being but also give yourself a better chance at restful, uninterrupted sleep. Consulting with a qualified healthcare provider is the best way to identify any underlying factors and create a treatment plan that supports both your health and your quality of life. Addressing the root cause, rather than just the symptom, leads to more lasting and meaningful relief. In conclusion, managing frequent nighttime urination, or nocturia, is not just about improving sleep, it's about enhancing your overall quality of life. By adopting practical, science-backed habits like limiting fluid intake in the evening, avoiding bladder irritants, establishing a consistent sleep and bathroom routine, elevating the legs before bed, and addressing any underlying health conditions, you can take meaningful steps toward reducing nighttime interruptions. These habits work best when practiced consistently and tailored to your individual needs. While occasional waking at night may happen, making small but intentional changes can significantly improve bladder control and lead to more restful, uninterrupted sleep. If nocturia continues despite lifestyle adjustments, it's always wise to seek guidance from a healthcare provider to ensure there are no underlying medical concerns. Prioritizing your nighttime health means you're also supporting your energy, focus, and well-being during the day.